Hey, you guys, happy Wednesday. Welcome back for another Work It Out Wednesday where we work out a practice question. Now, this week we have been covering all things hypertension. If you haven't had a chance, go check out the video from yesterday where we discussed the AC and AHA guidelines for hypertension and a few of the common treatment options, such as the thiazides, the ACEs, the ARBs, and the calcium channel blockers. But today, let's just work it out and test your knowledge on a couple of these questions, okay? Question number one states Miss Shepard is a 47-year-old African American female that presents to the office today for follow up. She has a past medical history of diabetes and asthma. Her blood pressure today is 142 over 92. At the previous visit, we discussed initiating lifestyle modifications. What is the next best step by the nurse practitioner? A. Initiate hydrochlorothiazide. B. Initiate lisinopril. C. Initiate amlodipine. Or D. No changes are needed at this time. All right, put your answer in the comments. Tell me what you think, and I'll give you a second to work through it. All right, as always, I tell you guys to read the stem of the question first so that it slows you down so that you can ensure that you are answering what is even being asked of you, right? So the stem of the question states, what is the next best step by the nurse practitioner? All right, so what phase are we at now so we can know what we need to do next? So the patient is 47, African American. She has a history of diabetes and asthma. We started lifestyle modifications at the last visit and her blood pressure today is 142 over 92, so it's still elevated. So you need to take a moment and think about the ACC and AHA guidelines, right? So with that, remember we talked about that 120 over 80, that pre-hypertension phase, if it's greater than that. 130 over 90 is for the people who have comorbidities. That's that goal. So if it exceeds that, they need treatment, right? And then the 140 over 90 is for that healthy population. So here, she's clearly over all of those stages, but she has a history of diabetes and asthma. So she does have comorbidities, right? So with that, we know that we need to initiate some type of medication treatment. We've done the lifestyle modifications. You do want to continue that. So now when you're thinking of the next step, we know it's initiating the medicine, but which medication, right? So you want to think, all right, so what are the common first line? We know thiazides are, right? She's African American, so thiazides work well with the African American population. So A is a thiazide, but wait a minute. She has a past medical history. She has a past medical history of diabetes. So that means that we need to consider what? An ACE or ARB, right? Because we want to protect those kidneys. So remembering that ACEs end in pril, ARBs end in sartan. So if you look through, B ends in pril, that is initiating lisinopril. So B is your best answer choice, okay? All right, question number two. A nurse practitioner is reviewing her patient's BP log from the past month, and it ranges from 120 to 126 systolic and 74 to 82 diastolic. Today's BP reading is 122 over 80. At the previous visit, the patient was educated on lifestyle modification, and this has since been implemented. The patient does not have any other past medical history. Based on these findings, what would be the next best step by the nurse practitioner? A. Initiate hydrochlorothiazide. B. Initiate lisinopril. C. Initiate amlodipine. Or D. No changes, continue lifestyle modifications. All right, tell me what you have in the comments. All right, okay. Again, let's read that stem first, right? So the stem of the question states, based on these findings, what will be the next best step by the nurse practitioner? So, all right, so we've been doing a BP log for a month, started those lifestyle modifications apparently at the previous visit. And so the last month, the blood pressure readings have been normal, right? They've been ranging 120 over 126 systolic and 74 to 82 diastolic. Blood pressure looks good today at 122 over 80. It is slightly over that 120 over 80 range, but that's something we can continue to monitor, right? Because they're doing the lifestyle modification and it seems as though it is helping. The patient does not have a medical history a past medical history. So, that goal is not to exceed that 130/90. So you don't need to initiate any meds. So your best choice here would be D, no changes at this time. And we want to continue those lifestyle modifications. You will continue to monitor the blood pressure. If it begins to exceed that 130/90 and 140/90, then you will initiate treatment. And specifically for this patient, because they do not have a past medical history, so no comorbidities, if it exceeds that 140/90 is when you would then decide to initiate medicines. All right, you guys, I hope you found this helpful. And if you're still having some difficulty, go check out the video from yesterday so that it really breaks this down where I talk about how to work through those guidelines. And again, check out the video too where we did previous hypertension questions. Again, I'll add that in the description. But be sure to meet me back here, like, comment, subscribe, and share with someone you may think that will find this helpful. And as always, meet us back here next week for some more Work It Out Wednesday questions. Bye, y'all.